Well, for more updates on the Mokwa flood, we have joining us via telephone the Acting Director General of the Niger State Emergency Management Agency, Dr. Ibrahim Hussaini. He joins us from Mina. Thank you so much for joining us on the news. You're live on Arise News. Can you just tell us what your agency is having to do at this moment to bring relief to the displaced people of Mokwa, and if there are any challenges you're facing, because we seem to be hearing a lot about NEMA, which is the National Emergency Management, and not so much about efforts at the state level.
Good evening, and I'm happy to be part of you this evening. I want to say that everything that has happened there, NEMA as being the one on the ground. We were the first respondents, and then later joined by NEMA, including IOM and then the Red Cross. The search and rescue operation was a collaborative effort between these organizations, including the locals there who knows the terrain and can swim, and those people are the downstream of River Niger. So to say that we are not there, it is an understatement, or probably the person that was there did not come to where the event was happening, because the Niger State Emergency Management Agency was the one that was taking lead in the coordination of all the interventions, including search and rescue operation. Though we have a senior army officer, the director of search and rescue operation in NEMA, because of his expertise because it's an air force, and they brought the helicopter that was going around, the chopper that was going around to tell us to supervise, and then assess the environment in the review and come down to give us the nature of the environment and tell us where we're supposed to go. But NEMA has been there, and then the NEMA came and brought their river system. But that very day, also today, the state government provided 6,000 bags of rice, and since then it has not stopped. The wife of the governor was also there with relief assistance and donation. The state government has opened an account for Mokwa victims, and the money has been pouring. The governor has also invite or solicit support from international community, our partners, donor agencies, the corporate organization, and well-meaning individuals, of which, as I speak to you, the relief assistance in that place all were as a result of the intervention of the governor, who has been up and doing. And as I speak to you also, all the activities of the state government has been geared towards bringing support to the people of Mokwa, because all the MGAs that are response agency, none of them is in Mina. All of them are in Mokwa, and they are putting their heads together to ensure, because governor is called farmer governor. And why is he called like that? Because he said...
Dr. Ibrahim, if you can hear me. Yes, you're talking about the efforts and the governor being up and doing. But my question really is, what are you doing to bring succor to the displaced person? You mentioned 6,000 bags of rice being shared. Beyond rice and grains being shared, what are you doing as the Emergency Management Agency to bring relief to them, was my question.
Okay, we have open camps in collaboration with NEMA and UNICEF, and then all the requirements in the camp have been made on a gradual process. And also, we have taken did what we call profiling of every individual that was involved, every household, including the houses that was involved in this unfortunate incident, so that we could be able to know and plan for them. The Commissioner of Works, the Commissioner of Health, because the environment seems to be having a foul smell, so the governor has directed all the Minister of Health to take charge and take responsibility of that, including the Minister of Environment. The Minister of the Minister of Water Resources is also there to provide pure and potable water for the people there. We, in collaboration with our international donor agencies, including the local agency, NEMA, SEMA, IOM, we are there, and we are taking care of those that are in the camps.
Right. Mr. DG, when you say you're taking care of those in the camp, we know the president has given a directive that about 20 trucks of food supplies should be sent to Mokwa. Have those palliatives arrived? The packages, have they arrived? Has the process of distributing this help started. And how, I mean, in terms of the numbers of people affected, what figures do you have? Do you have any clear figures that you can tell us?
Okay, the palliative of the federal government is already coming, and they have been uploaded in the warehouses. Though before the coming of that, there are many people that have donated, and the government has also brought so many of them, and is still bringing, because it was coming batches. They have what you call a company called Niger Food. The governor has directed them that they should face Mokwa and ensure that the needs of those people in terms of food is met, including the sleeping materials and non-food items. And as I also, you also asked that the relief material from the government has not been distributed to them yet, because it's just coming on the way.
Are there challenges when it comes to evacuation and recovery of bodies to avert any outbreak of diseases? Does NEMA have the capacity to, address or carry out operations of this magnitude?
Yes, we have the capacity. We have over 3,000 people that were directly or indirectly affected. We have so far recovered 161 deaths and buried, because we don't, all of the organizations are there. We do not work with hearsay. We must confirm and verify each dead body that was recovered, so that we don't work with speculations. So if you ask all the response agencies there, they will tell you what actually number that we have gotten. So the rescue operation is still ongoing. And then the challenges we're having, when you have people at this kind of magnitude, it takes time. So you'll be having initial challenges of people coming to camp of different what do you call it, complaints here and there, pockets of complaint. But as the situation improves, we also begin to scale up our service provision, so that we will reach a kind of stage where we said, okay, we are now there, and then everything will begin to move normal.
Mr. DG, before this incident happened, there were predictions, and Mokwa was highlighted as a high-risk area. As SEMA, did you get that information, and did you plan ahead, or is your agency just about reacting to tragedies when they happen? Maybe you can enlighten us tonight. Is the Emergency Management Agency just about being reactive and not proactive? What did you do with the information that Mokwa was a high risk area when it comes to flash flooding for 2025?
I want to say that since the inception of Niger State in 1976, or creation of Niger State in 1976, we have been witnessing flood year in, year out, but the magnitude differs. So we do not even wait for the prediction, either from NAMET or from NISA, because we know what we face. The flood situation in the state has been studied, and we know those that are at risk. But from the prediction, if you look at Mokwa as a whole, the local government was the one that predicted, because they have riparian community people that are living within the floodplains of the upstream river Niger, and downstream of Jebadown, and downstream of upstream Jebadown, and downstream Jebadown. But Mokwa town as a whole, for the first time, this is the first time we are going to witness flood in this kind of magnitude. We have never lost maybe 1 or 2, 3 lives before like this. And if you look at the west, the north, the south of that Mokwa town, it will take you at least 40 kilometers from each angle you are coming to get to any major river or any tributaries. So this took us unaware, because we never expected that this will come. If you ask even the indigenous, they will tell that this kind of things has never been witnessed before. But we are being on ground. In fact, those that are downstream are very much, or the riparian communities there are very much aware that there is flooding, and we are synergizing with them. We are working with them year in, year out. We have our volunteers there. We have a response communities there. Those that we have trained on time of flood and water emergencies. They are there. We are downscaling on yearly basis. Every year we go there. We are also liaising with in partnership with dam authorities. Before they release water, they will write to the state government, write to all the river agency, write to this community, and they will do what we call community engagement to tell them that this whole time we'll be releasing our water. And even after the spills, they will also go around to be monitoring the movement and also the people there, and ensure that they are up. And when we received the prediction, we never waited. higher grounds were identified. As I speak to you, we have the government has also purchased stockpile relief assistance in case if it happens. So we are never taken unaware. It's just that Mokwa situation was the one that gave us that came unaware, because it has never happened like that before. But we have communities that are more, maybe about 30-40 kilometers down and upstream of Mokwa that are normally flooded because they are prepared community. And the state government on its own it has what you call resettlement scheme, about 16 resettlement centers in the state, and this is to cater for all these people. But as you are aware, resettlement program is capital intensive. It has been a gradual process, but we have temporary places where we move them to when this flood starts. So it has not been something that we have been maybe waiting to react. We have okay. We are proactive. Yes.
Acting DG, thank you so much. Well, poor disaster preparedness has been cited, and of course we are hearing that more rainfall is predicted in the same Mokwa area. We hope you're very well prepared to address, whatever challenges would arise from that. Ibrahim Hussaini is Acting DG, Niger State Emergency Management Agency. Thank you very much for joining us.